Is Ozempic a medical marvel or a ticking time bomb? In the realm of pharmaceutical breakthroughs, few drugs have stirred up as much intrigue and debate as Ozempic. This enigmatic medication has emerged as a potential game-changer in the treatment of a variety of medical conditions, but its shadowy origins and mysterious side effects have left many in awe. Join us on a thrilling journey as we delve into the world of Ozempic, uncovering its approved uses, mechanism of action, other potential applications, daunting side effects, and the expert medical advice surrounding it. Ozempic is a medication containing semaglutide marketed for type 2 diabetes or weight loss for people that are overweight and have weight-related medical problems. Section 1. Approved uses of Ozempic. There are currently 3 FDA-approved semaglutide products. The first is Ozempic injection and the second is Rybel-sus tablets are approved to lower blood sugar levels in adults with type 2 diabetes, in addition to diet and exercise. Ozempic is also approved to reduce the risk of heart attack, stroke, or death in adults with type 2 diabetes and known heart disease. The second FDA-approved semaglutide is Wegovy injection, which is approved to help adults and children aged 12 years and older with obesity, or some adults with overweight, who also have weight-related medical problems, to lose weight and keep the weight off, in addition to diet and exercise. This means that the drug is only approved for 1. Adults with type 2 diabetes, in addition to diet and exercise. 2. People that are overweight and have weight-related medical problems. All 3 medications are only available with a prescription. Section 2. Mechanism of action. Semaglutide belongs to a class of medications known as glucagon-like peptide-1, abbreviated as GLP-1 receptor agonists. It mimics the glucagon-like peptide-1 hormone that is released in the gastrointestinal tract in response to eating. One role of GLP-1 is to prompt the body to produce more insulin, which reduces blood glucose. GLP-1 in higher amounts also interacts with the parts of the brain that reduce appetite and signal a feeling of fullness. As a glucagon-like peptide-1 receptor agonist medication, it increases the levels of incretins, a hormone, which helps your body to produce more insulin when needed. It also suppresses the amount of glucose produced by the liver. By stimulating glucagon-like peptide-1 receptors, Ozempic does the following. 1. Aids in the release of insulin. 2. Slows down gastric emptying. 3. Suppresses appetite and signal a feeling of fullness. 4. Promotes weight loss. This intricate interplay of physiological effects has far-reaching implications beyond its approved uses. Section 3. Unconventional uses of Ozempic. While Ozempic's primary purpose lies in diabetes management, whispers of its potential in other medical domains have spread like wildfire. Rumors suggest that this enigmatic drug holds promise for polycystic ovary syndrome and even neurodegenerative disorders like Alzheimer's disease. Please note that none of this uses is approved yet as of the time of making this video. Could Ozempic be the key to unlocking a multitude of medical mysteries? The evidence remains circumstantial but intriguing. The answer is in the outcome of future research, and we will like to keep you updated if you subscribe to our channel. Ozempic and weight loss. People with type 2 diabetes who use Ozempic can lose weight while using the medication, which happens partly due to its effect on 1. Reducing your appetite so you eat less. 2. Slowing down the movement of food in your gut, meaning you stay full for longer. Section 4. Side effects of Ozempic. Reports from patients using the drug have surfaced, detailing alarming occurrences ranging from gastrointestinal distress, such as nausea, diarrhea, and constipation, to more severe complications like pancreatitis and thyroid cancer. Swelling, redness, itching at the injection site may also occur. The veil of mystery surrounding these side effects has led to intense scrutiny and raised critical questions about the drug's long-term safety profile. Data showed that the use of Ozempic is associated with higher rates of diabetic retinopathy and bad eye events compared with other glucagon-like peptide-1 receptor agonists. Tell your doctor if you have diabetic eye disease or if you experience eye problems during treatment with Ozempic. More information about the side effects is contained in the patient information leaflet, which comes in the box of the medication, so make sure to read this. Section 5. Medical advice. Ozempic is a type 2 diabetes medication which is prescribed to manage blood glucose levels. It is not a medication for people who do not have diabetes or are at risk of type 2 diabetes. A prescription for Ozempic should only be administered following an assessment by your healthcare team to make sure that you'll benefit from its use. This will depend on your personal circumstances, and there are several important factors that need considering. These include the dose, the risk of side effects, and a person's lifestyle and current treatment plan. Please subscribe to our channel so that you can be notified when we release the next video on Ozempic and other related drugs. Note that knowledge is advancing by the day, and we will like to always post an update on new advances on how to stay healthy. You can contact us via the link in the description below for any medical inquiry. You are watching Zoom Hospital channel and listening to work of Dr. Kayode.